Welcome back to Module 2 of 1016 MSc, the muscular system. In this topic, 2.2, we will become familiar with some functional groups of muscles, starting with those in the head, neck, thorax, and abdomen. Open your workbook to Module 2, Topic 2.2, and see if you can start to answer some of the questions that relate to the content covered during this mini-lecture. The learning outcomes for Topic 2.2 are to be able to identify selected muscles of the face and neck and know their actions, identify selected muscles of the thorax and abdomen and know their actions. Let's start by looking at some of the muscles located in the head region. These include muscles of facial expression and the muscles of mastication, or those involved in chewing. Muscles that promote facial expression lie in the scalp and face, just deep to the skin. They are unusual in that they insert into the skin rather than into bone. Orbicularis oculi is a thin sphincter muscle of the eyelid that surrounds the rim of the orbit. Its function is to close the eye, so it assists with blinking and squinting and helps protect the eye from light. Orbicularis oculi is innervated by the facial nerve, cranial nerve number 7. Zygomaticus major and minor are a pair of muscles extending diagonally from the zygomatic bone, or the cheekbone, to the corner of the mouth. Zygomaticus raises the corners of the mouth so we can smile. It is also innervated by the facial nerve. Risorius lies inferior to zygomaticus, arising from the fascia associated with the masseter, and inserting at the angle of the mouth. Risorius is the synergist of zygomaticus, as it draws the corner of the lip laterally and assists with smiling. Orbicularis oris is another circular sphincter muscle, but this time associated with the lips. Contraction of orbicularis oris closes the lips and allows us to purse or protrude the lips, as if trying to whistle or kiss someone. The buccinator is the deep cheek muscle running horizontally from the maxilla and mandible towards the orbicularis oris. It has roles in both facial expression and mastication, and is also innervated by the facial nerve. While the buccinator draws the corner of the mouth laterally, it primarily compresses the cheek during suckling or whistling, and holds the teeth together for chewing. It is the muscle that helps babies suckle, and trumpeters play their instrument. Temporalis is a fan-shaped muscle originating on the temporal fossa and inserting on the coronoid process of the mandible, via a large tendon passing under the zygomatic arch. The main function of temporalis is to close the jaw and maintain the position of the jaw at rest. Temporalis elevates and retracts the mandible during chewing, and is innervated by the trigeminal nerve, cranial nerve number 5. Lastly, but very importantly, is the masseter, a powerful muscle that stretches from the zygomatic arch to the angle of the mandible. The masseter elevates the mandible and is the prime mover for closing the jaw. It is also innervated by the trigeminal nerve. Let's look at how some of these muscles and their movements are associated with facial expression. Zygomaticus major draws the corner of the mouth laterally and superiorly, allowing us to smile. Orbicularis oris is the circular sphincter muscle that puckers the lips ready for a kiss. Orbicularis oculi is the circular muscle that closes the eyelid while blinking or squinting. Interestingly, not all smiles are the same. The pioneering French neurologist Guillaume Benjamin Duchenne believed the muscles of human facial expression were directly linked to the soul's emotions. Duchenne wrote that the zygomaticus major could be willed into action, but that only the sweet emotions of the soul force the orbicularis oculi to contract. He said that the inertia of orbicularis oculi when smiling unmasks a false friend. Consequently, a Duchenne smile is considered to be a genuine smile, reflecting true happiness and positive emotions. A non-Duchenne smile is described as a social smile, which may in fact be a cover for a multitude of different emotions. The smile you deliver when someone says, "Say cheese." While both smiles involve contraction of the zygomaticus major muscle, which raises the corners of the mouth, only the Duchenne smile involves contraction of the orbicularis oculi muscle, the squinting muscle, which raises the cheeks and forms crow's feet around the eyes, the sign of someone who is truly happy. Can you determine which of the pairs of photos depict a Duchenne smile and which pair depict a non-Duchenne smile? The faces labelled A show two men displaying non-Duchenne or social smiles. The faces labelled B show the same two men displaying Duchenne smiles with genuine positive emotion. Two famous Duchenne smiles that you may be familiar with belong to George Clooney and Barack Obama, who clearly display not only contraction of the zygomaticus major at the edge of the mouth, but also the squint produced by contraction of the orbicularis oculi. Now it's quiz time. So, which muscle is it? Which muscle is labelled A? Orbicularis oris. Which muscle is labelled B? Buccinator. Which muscle is labelled C? Temporalis. And which muscle is labelled D? The masseter. Next we move on to muscles that move the head, which are located in the neck. The sternocleidomastoid is the double-headed muscle located in the anterior compartment of the neck that lies deep to the platysma in the skin. It has two origins, one sternal and one clavicular, and inserts into the mastoid process of the temporal bone. The sternocleidomastoid is the prime mover of head flexion. When both left and right muscles contract simultaneously, known as a bilateral contraction, the neck flexes. If only one sternocleidomastoid contracts, a unilateral contraction, the head laterally flexes to the same side while rotating to the opposite side. Try palpating your own neck. Flex your neck laterally, then rotate your head to the opposite side against some resistance. Can you feel it shorten as it contracts? The splenius capitis muscles are located in the posterior compartment of the neck. They originate on the spinous processes of the superior thoracic vertebrae and insert on the mastoid process of the temporal bone, deep to the sternocleidomastoid. Contraction of bilateral splenius capitis extends or hyperextends the head at the atlanto-occipital joint. Unilateral contraction of the splenius capitis rotates and laterally flexes the head to the same side. Sternocleidomastoid and splenius capitis are located in opposite compartments, so they are antagonists of each other. As a general rule, the action of a muscle can be inferred by the position of the muscle relative to the joint it crosses. The examples on this slide relate to the shoulder joint. A muscle that crosses on the anterior side of a joint produces flexion. A muscle that crosses on the posterior side of a joint produces extension. A muscle that crosses on the lateral side of a joint produces abduction. And a muscle that crosses on the medial side of the joint produces adduction. This general rule applies for muscles in the upper limb, the thorax, the abdomen, and the hip. However, there are exceptions to this rule. Muscles crossing the knee and the ankle will be discussed on the following slide. As we saw in the previous slide, generally muscles in the upper limb held in the anatomical position can be compartmentalized as flexors in the anterior compartment and extensors in the posterior compartment. In fact, muscles from the hip superiorly, located in the anterior compartment, are mostly flexors. However, muscles from the hip inferiorly in the anterior compartment are mostly extensors. The opposite. That is, lower limb extensors are located in the anterior compartment and lower limb flexors are located in the posterior compartment. For example, knee extension is produced by the quadriceps muscle in the anterior compartment, and knee flexion is produced by the hamstrings in the posterior compartment. Why would this be so? This is the result of rotation of the lower limb 180 degrees during embryonic development. The following general rules then apply to the limbs, abdomen, and erector spinae muscles of the back. Anterior muscles from the hip superiorly are flexors. Anterior muscles from the hip inferiorly are extensors. Try and flex your shoulder. With reference to the anatomical position, does your arm move anteriorly or posteriorly? Now, try flexing your elbow. How about flexing your hip or your knee? Flexing which joint moves the limb in an anterior direction, which moves it in a posterior direction. You probably notice that when the shoulder and the elbow joints are flexed, the arm moves in an anterior direction. When the hip and the knee joints are flexed, the legs move in a posterior direction. Now we move on to look at the muscles located in the thoracic region. These muscles have several key roles. They can stabilize and extend the vertebral column. They can stabilize or move the scapula. They can assist with respiration. And they can move the arm at the shoulder joint. Respiration will be covered in Anatomy and Physiology Systems 2. However, just briefly, the diaphragm is the prime mover of inspiration, innervated by the phrenic nerve. The external and internal intercostal muscles run between the ribs and assist with inspiration and expiration, respectively. Muscles that move the arm are categorized in the upper limb section, contained in the next mini-lecture. Moving inferiorly from the thoracic region, we will also look closely at the abdominal muscles. The key roles of the abdominal muscles are to stabilize and flex the vertebral column, and to move the lower limb at the hip joint. The abdominal muscles protect and support the viscera buried beneath them, and they run in different directions from each other in order to impart greater strength to the abdominal wall. The abdominal muscles attach to each other along the midline by a broad aponeurosis which forms the linea alba, meaning white line, a tendinous seam that runs from the sternum to the pubic symphysis. The abdominal muscles are most effective in supporting the viscera when they are well toned. Weak or severely stretched abdominal muscles, such as those seen during pregnancy or in someone who is overweight, allow the abdomen to form a potbelly. Let's start with the deep muscles on the posterior trunk. Erector spinae is the group name given to 3 columns of muscles, who are the prime movers of trunk extension. These include the spinalis muscles, running along the spinous processes of the vertebral column. They originate on the spinous processes of the upper lumbar and lower thoracic vertebrae, and they insert on the spinous processes of the upper thoracic and cervical vertebrae. The spinalis muscles are the most medial column of the erector spinae. The longissimus muscles are the intermediate or middle column of the erector spinae group, originating and inserting on the transverse processes of the vertebrae. The iliocostalis group is the most lateral column, arising from the iliac crests and the ribs, and inserting on the transverse processes of the cervical vertebrae and superior ribs. The erector spinae provide resistance that helps control forward bending at the waist, and are powerful extensors that assist in returning the trunk to an erect position. Contraction of only one side causes the vertebral column to laterally flex or side bend. Quadratus lumborum is a fleshy muscle that performs part of the posterior abdominal wall, and when contracted bilaterally, extends the lumbar spine. Unilateral contraction results in lateral flexion of the vertebral column, or, if the trunk remains in an upright position, contraction of one quadratus lumborum results in hitching the hip up on one side. The muscles of the erector spinae and quadratus lumborum together extend the trunk. They are located in the posterior compartment, opposite to, and therefore they are antagonistic to, the abdominal muscles. In addition to these long back muscles, there are also some deep, short back muscles in the posterior trunk that extend from one vertebrae to the next. Primarily, they act as synergists that extend and rotate the spine, and as stabilizers of the vertebral column. In particular, you can see on this diagram the rotatores and the multifidus muscles. Bilateral contraction extends the vertebral column, and unilateral contraction rotates the vertebral column to the opposite side. The most superficial muscles on the posterior trunk are agonists for shoulder or arm movement. 2 of the major superficial trunk muscles include trapezius and latissimus dorsi. We won't cover these muscles at this point, as they will be discussed in the muscles that move the upper limb section in the next mini-lecture in this module. Unlike the thorax, which has ribs, the anterior and lateral sides of the abdominal wall has no bony reinforcements. Instead, abdominal support is a composite of 4 paired muscles, their fascia and aponeuroses. These include the rectus abdominis, the external oblique, internal oblique, and the transversus abdominis. When these paired muscles contract bilaterally, they are prime movers of flexion of the vertebral column. Consequently, they are antagonists to erector spinae. The rectus abdominis is the most medial muscle of the abdominal group, extending from the pubic symphysis to the xiphoid process, and is very active when performing sit-ups or crunches. The external oblique, the most superficial abdominal muscle, is located laterally, with its fibers running in an inferomedial direction. You can follow the direction of these fibers if you place your hands in your pockets. The external oblique is used when performing oblique curls, which are sit-ups combined with rotation towards the opposite knee. The internal oblique muscle lies deep to and at right angles to external oblique muscle. And finally, the transversus abdominis is the deepest of the abdominal muscles and runs horizontally around the abdomen, acting like a corset, compressing abdominal contents. When performing a sit-up, the abdominal muscles contract concentrically, meaning they shorten in length, causing flexion of the trunk. A point is reached where the psoas major begins to contract, flexing the hip up, with increasing flexion of the lumbar spine. Rolling back down to a flat position on the floor again requires the abdominal muscles to act eccentrically, where they lengthen as they contract, to resist gravity. Eccentric contractions may cause micro tears in the muscle and lead to post-exercise soreness. In this slide, we can see the 4 paired abdominal muscles in a lateral view. A well-toned rectus abdominis creates the six-pack look. The external oblique, the internal oblique, and the transverse abdominis. A transverse section through the abdominal wall best shows the relative position of each of these paired abdominal muscles. Laterally, we find 3 of the layers. The external oblique is most superficial, overlining the internal oblique, and the deepest of the 3 layers is the transversus abdominis. The rectus abdominis lies more medially, in line with the internal oblique. This view reveals how the aponeuroses of the lateral abdominal muscle contributes to the overall rectus abdominis sheath. When the abdominal muscles contract with the airway closed, which is known as the Valsalva maneuver, the increase in intra-abdominal pressure favors urination, defecation, childbirth, vomiting, sneezing, and coughing. During any of these activities, you will notice your abdominal muscles contracting. They also work during heavy lifting to help protect the spine. Try to answer these review questions now that you have completed this mini lecture. You can find these questions in your workbook, and we can discuss your answers in the tutorial session. This is the end of mini lecture topic 2.2. Please continue with topic 2.3.